Next oral presentation will talk by Dr. Leong Tak Seng on the title Ectoparasites recover from whole cage freshwater treatment in culture marine fish disease outbreak in 14 cages. Dr. Leong received his PhD from University of Alberta, Canada, and was a professor of parasitology at University Sains, Malaysia. His major research interests are on parasites, disease, and health management in marine fish culture in 14 cages. He began his research in, you'll be surprised, 1986. Maybe some of the audience not even born yet. But anyway, the floor is yours, Leong.
Thank you, Dr. Suprani. My topic is essentially ectoparasites. And then the fish farm that I work is has 8 species of fish culture in there. In this study, I only look at crimson snapper, golden snapper, and spotted grouper. There are other fishes in there, but I don't look into them because they are not very much disease infected fish. This snapper, crimson and golden snapper, and the grouper are the ones that give major problem to our fish farmer. If you go to the fish farm, you very often see this problem of fish having a lot of necropsy on the body surfaces. And when you look at them, they are still floating out and the cages are not dead yet. And they all have a very similar kind of problem with scratches on the body. And maybe you have rotting tail and all those things. The question down in here is, what is the cause of this problem down in there? And we have to look into the problem and see what actually caused this problem in the fish out in the farm itself. When I look into this problem, I tell the farmers I will only do one thing. I will not do the normal thing of looking into individual fish. What I want to look at is on the farm in which when they do treatment on the fish on that, and what they do after the treatment, I will look at what is the content remaining at the bottom of the treatment pond, treatment basin. And what you normally see is there are 3 major groups of parasites: monogynia, parasitic crustacean, and leech, found in the bottom of the container. And these are the major parasites that are found. You have the capsulate monogynia. Mainly you have the neobenedinia and benedinia. But under the lab condition, you find that it's extremely difficult to differentiate between neobenedinia and benedinia. They are very, very similar. So in my study, it's very difficult because I have thousands of all these parasites to count. But what you can look at is the benedinia eugenie is very easily distinguishable from all others, in that this is very small. Now, if you look at the crimson snapper, this is what you see. You have this benedinia eugenie, the very small one, is very, very dominant in terms of number. There are very few of benedinia, and at the same time, you do not have a lot of other leech and cardiacus down in here. So you find that most of it in the crimson snapper is the capsulate monogynia. And this is from the whole cage of the fish in which they are treating. The next one down in here is the golden snapper. Again, in the golden snapper, you find the three groups that recover your Benedinia, monogynia, Benedinia, your Benedinia, your leech, and your grouper, your leech, and your parasitic caligus down in here. And again, you see that the caligus, no, the monogynia has the most number. You can get up to 96 or 97% of the total. But again, you see that in the golden snapper, Luteolus johnny is the highest. Now, when you look into the spotted grouper, it is the other way around. You have very few capsulate monogynia, but you have large number of leech present in there. So it is a problem with the grouper where you have a lot of leech present, less of the capsulate monogynia, or the copepod, parasitic copepod. On the other hand, even though you find that grouper can have a lot of leech infecting them, but on and off, if you look at it carefully, you may have grouper that have infected with large number of capsulate monogynia. So it's not really that the grouper is always infected with large number of leech. So it depends on where your cage are situated, near to where a lot of the snapper, or it is away from it. But you'll find that in the farm. Now, what you see is that this study is very interesting in that they use the fluorescent dye on the Onchomycetium, on the Neobenedinia for infection, check through the infection in the sea bass down in here. You see that the Onchomycetium, when they landed on the fish down in there, they tend to move all over the body down in here. And at the end, they accumulate most of it on the head region and at the bottom of the fish down in here. So you find that in the life cycle of the monogynia, they move all over body and is feeding on it. Whereas on the other hand, when you have large number of leech, the mature leech, you find that a lot of them are reddish in color when you examine them at the bottom of the container. And so they are essentially feeding. And at the same time, you find that it irritating the fish. They scratch on the side of the net, or it all get injury. As a result, you have bacterial infection. Now, my general conclusion is that in the farm, under farm condition, capsulate, monogynia, caligus, and leech are well established, infecting all marine fish within the floating cage ecosystem. Constant removing of ectoparasite and constant reinfection of ectoparasite after freshwater treatment could result in a process of natural vaccination with fewer disease outbreak as the fish grow. In general, large number of capsulate monogynia dominates the ectoparasite in snapper, but in grouper, you find that it is mainly on the leech. And the study that I've done in the farm, when they repeated all this freshwater treatment, the fish tends to have less and less disease outbreak. And as a result, after 1 year, you find that they hardly have any disease outbreak at all. So what I look at the thing down in here is not really necessary for the farmers to use vaccine or antibiotic or whatever chemical you want to use in the fish. all they are interested is essentially once they remove the parasite, and over time there's less mortality, and so what they want is that after 1 or 1.5 years down in here, they can market the fish, and that's what they are interested in. Because I've also tried using a vaccine, it doesn't really work out in the farm itself, because the vaccination process has to be done in the hatchery, not when the fish come onto the floating cages environment. That doesn't really work for the farmers. I think that's all I have to present on this particular small study on this, and I leave it to farmers down here to decide what they want to do as to whether they are interested in this on and off kind of freshwater treatment on this. Of course, the other problem.
Thank you, Leong, for your conclusive presentation. I think we have one from Melba. Media.
Yeah.
Yeah, you can read it from chat.
Yeah, on this, in as far as the your Benedinia is concerned, you see, this is a major problem right from the initial stage where you set up your culture, because you are bringing in wild stock, wild grouper, or whatever it is into the farm. Very often, this grouper from the wild are already infected, so they are bringing into the farm. And once you bring it into the farm, you'll never be able to get rid of them. You just keep on going. Now, I've looked at the farm situation right from 1986, up until the present time. And earlier on in 1986, they only have estuary grouper, right? They don't have tiger grouper, they don't have giant grouper, or they don't have hybrid grouper. So over the years, I look at the thing when they have estuary grouper, they only have Benedinia and your Benedinia. But the moment you start introducing snapper, crimson snapper, golden snapper, you have a problem of this spreading all the farm, all the fish species that culture in the farm. And in this case, when you introduce your snapper, especially the crimson snapper, they're very susceptible to large number of Benedinia lugeni. And so when you have, every time you introduce a new fish species in there, it just spread on. You can never get rid of them anymore on this. So the only way in which now we can do is to reduce the population, to allow the fish to sort of gradually immunize itself as sort of like vaccine for them. And what the farmer would like to do then is to grow them large enough to be in marketable size and sell it off. That's all they do on that. You never be able to get rid of the parasite once they are introduced into the farm. Okay. These are all essentially coming in from the wild, and you can never get rid of them anymore.
Mm-hmm. When it starts, it's very difficult to get rid of them. Yeah. Okay, thank you very much, Leong, and hope to see you again in the future. Okay.
That's funny.
Thank you.